Today we're going to hear, please, if everybody can turn their cell phones off or on vibrate so as not to interrupt. Today we're going to hear about Medicare, specifically Medicare Advantage. How does it compare with original Medicare, which we're all familiar with. Typically these presentations are given by insurance experts that speak more to the financials of a Medicare Advantage plan. Fortunate for us, we have with us not only an insurance expert, but also a caring registered nurse whose career has spanned many venues, hospital, nursing home, and presently a health plan. So without further ado, I'd like to introduce Lea Gould.
Thank you. I'd like to make this session as useful for you guys as possible. So I put together a PowerPoint, but please, we don't need to stick to this. It's going to hit some very important pieces here that will prompt some conversation. But please, at any time, feel free to ask any questions. I want to help you understand what Medicare means. So, the first and foremost, let's get to basics. Please have a seat. Come on in. There's plenty of seats. Medicare is a benefit that you receive after you've worked for many years from the government or if you're disabled. And there are four parts, Part A, B, C, and D. A is hospital, basically. B is physician and ancillary. C is Medicare Advantage Plan. Why it's one of the A, B, C, D does not make any sense, but it is the government. So we're going to try and make you understand a little bit about that. And Part D is prescription. Oh, didn't work. Why didn't that? There we go. Okay, so hospital coverage. What does that cover? It's your inpatient hospital stay. It's emergency room visits. Outpatient services, same-day surgery that you have in the hospital. You're going to have inpatient skilled nursing in a rehab center, a nursing home if you have a skilled need post-hospitalization, or any inpatient behavioral health setting. Okay, Part B. Physician ancillary services. Gets a little complicated here. It's mostly physician coverage, whether it's your primary physician or your specialist. It also will cover urgent centers. They may be called doc in the boxes, but these little centers, not affiliated with hospitals. They're standalone centers. And any outpatient laboratory services. So if your physician is seeing you in his office and gives you a script to go to a lab, that's covered under Part B. Certified home health care services. Oh, please. What that means is if you've had a hospital stay, a nursing home stay, or all of a sudden you've become ill and your physician wants you to have certain services in the home monitored by an RN, it's called a CHA. That will encompass nursing. It can be physical therapy, it can be occupational therapy, and it can be a home health aide. Now, these services through Medicare must only be utilized if you have a skilled need. Skilled need means you have a wound and a dressing needs to be changed. You need help pouring your medications. You've had maybe a fall and broken a bone, and you need some physical therapy in the home because you can't make it to a physical therapy outpatient clinic. So if you need something, if you're in the home and cannot manage to get out, that will come through your Medicare benefit. Now, if you need aid services while you're going through that service, the maximum service that you can get here is 20 hours a week. You cannot get more. Now, if you or your loved one needs PCW, it's a personal care worker or personal care attendant for a long term, and it's not with the skilled benefit, you're going to need ELIXA. And that's a licensed home care agency, and it is not a covered benefit for Medicare. It's a Medicaid benefit that you can get, but under Medicare, it is not a benefit. And durable medical equipment, that means something that you can use over and over again. Shower chair, a wheelchair, a walker, a rollator walker, grab bars. Any question? Yeah.
One last thing. I know it's your presentation, but some medications are also billed on the Medicare Part B if they
Yeah.
get filled under under a DME somehow.
Well,
In that case.
in some cases. If it's a wound care medication, it's very specific. But this, most of the Part B medications are medications that are utilized by physicians either in outpatient clinics or in their office. Some chemotherapeutic drugs, some orthopedic medications. So there are different things, but it's really for the physician in the background to get that authorized for you, nothing that you would necessarily need to do. Any questions before we move on? Great. Yeah.
I have one question.
Sure.
Is Medicare national or is it state?
Federal.
So I'm saying, if someone lives in Florida, are you talking about the same thing?
Yep.
She
Yeah.
gets it in
Yep.
Florida versus-
Yep. Yep. Medicare is the same throughout all 50 states. There may be some little nuances, but this, on the whole, is the exact same. So Part D prescription drugs. You're going to your local pharmacy, and when your physician writes a script, that's what you're going to get. It can be written by a nurse practitioner. It can be written by a DO, a doctor of osteopath. It can be by a physician assistant or a physician, any of your specialists, but they all can be filled at your local pharmacy. Now, if you, yes, how much is it? It depends. There is a coverage cost. It's a couple of dollars, and it's taken out before you get your Social Security benefits. Now, as you probably noticed, we kind of went out of order. We did A, B, D. We're going to go back now to C. C stands for managed care. It is a company that is licensed to provide you the services to manage them. The government, the Center, CMS, the Center for Medicare and Medicaid Services, licensed these companies, which we are one of. But there are many. There are the Oxfords, the Uniteds, the Emblems, the Aetnas, ARP. They all are mandated to have certain standards. You have to cover certain things. And there are little bits of leeway here and there that different companies can offer a little bit more on certain things to attract you to come and enroll in their plan. But one thing that they all do is they manage your care. What does that mean? It means that part of managing your care, they're going to authorize services, they're going to authorize length of stay. They're going to help your physician manage your health along the way. Any questions? We'll get into more specifics.
You have to use their secondary insurance like AARP.
Well, AARP, if it's a Medicare program, is this. They do offer a supplement. Yes. So that sits on top of it. So you pay extra for that to enhance your benefits. Yes?
What kind of guarantee is it that the way they think your care should be managed is the way your care should really be managed?
The standards that the government issues are the standards that Medicare agencies must abide by. So they're rated by these standards. Part of everyday life with Medicare is living with these standards. So we're going to get into this a little bit more, but it's best practices across the board. And I'll get really specific later on.
If this is for services that are provided by physicians and hospitals, you mentioned that that was part of Part A and Part B anyway.
Yes.
So why do I need somebody to manage something that I'm entitled to under Part A and Part B already?
You're still getting it. You're getting an added service with this management. Going through the muck of healthcare can be very confusing and very difficult. And if you don't know your ins and outs about it, it can make you want to pull your hair out. It's very difficult. If you're in the hospital and trying to deal with, let's say, a broken leg, a managed care organization will step in, speak with the organization, the hospital that you're in, and arrange either skilled nursing home facility, if that's what you need, or home care. So they're going to help decipher that, help move things along, so that you get the appropriate services at the appropriate time. When you're left on your own through this, it's very hard to arrange that yourself. It's very hard because your health is compromised. You're in the middle of trying to deal with issues, whether it be for yourself or your loved one, and it can take an awful lot of time. I can tell you, I have a lot of nurses that work for me, and they can spend all day working out one person's issue. I myself, yeah.
Sorry to interrupt. If anybody came on the Brooklyn bus, it's leaving now. That's all I'm saying.
No problem. I myself have elderly parents. My mother is 89 years old. And I can tell you, I know the system. And I know how much time it takes me to decipher it, to make it work. So it is difficult. Yes, you have a benefit. And yes, you do not have to sign up. And that's what this is all about. By all means, just be educated. Understand the pros and cons of each. That's all I want to do. I want to empower you to be able to make those decisions as you go. I need a plug. Is it plugged in? Okay, straight versus managed. So this is what we're going to get into now. Managed Medicare network is strict. The way they manage the network, the way they manage your care, they take the network from everybody in the universe that's out there and contract with a few people, and then drive the care through those people. All right, so there are, again, very strict guidelines with any managed care organization of how many providers per area, per mile that they have to meet. It's not an easy task. There are a lot of problems that you can have, but on the whole, they have to meet a 10 minutes or 10-mile regulation. Care expectation for physicians here and managed care are really great because the managed care organizations are judged by the government by these regulations. Now, you were talking before about why. Well, there are a list of medications out there called the Beers List or high-risk medications for seniors. And some of them on there could be medications to prevent clotting or sleeping pills. There are different medications out there. And the government has come up with the standard saying these medications should not, at these doses, be prescribed to seniors. Because what's going to happen is they're going to get confused and they can fall. And if they fall, they can break a bone, or they can hit their head, they can bleed out. There are other issues that can happen. What these managed Medicare organizations do now is they make sure that all those physicians that work for them abide by these rules. And I can tell you, I argue with physicians all the time about this. Oh, I've been giving this person Ambien for the last 20 years. It's a sleeping pill. Why can't they have it now? It's like, because they change. It's not good for them. It's proven. There's research out there that says it's not good for them. This is a big difference, a tremendous difference from physicians that practice and don't take Medicare, managed Medicare. There's nobody standing over them telling them to do these things. And there's quite a few, making sure that some physicians order for diabetic patients, podiatry visits twice a year, glaucoma visits twice a year. These are standards that the government has said is important for all seniors to be managed under. So, yes?
A minute ago you said something about 10 minute and 10 miles.
Mhm.
I'm not sure what that
For
is.
providers. So if a managed insurance company has only 2, let's say, orthopedists in Queens, and it takes you a half hour to get to that orthopedist, it doesn't meet CMS standards. It's got to either be within 10 minutes or 10 miles.
Thank you.
Okay? Okay, so again, these standards are not maintained in the community. And I would love to say, and I work with physicians for the past years, there are plenty of physicians that order everything that they should. And then there are plenty of physicians that don't. That doesn't mean physicians are bad across the board. It's just that they're held to another standard, a higher level. Any questions? Yes.
If there isn't a provider within 10 miles or 10 minutes,
CMS won't allow them to have a license to practice. They have to provide you somebody. Okay? They must. Those are the CMS rules. So if they're not, you can hold your managed Medicare agency to task and say to them, it takes me an hour or whatever time to get to them. It's you're telling me to go to an orthopedist 3 boroughs away. It's going to take me an hour. I need somebody. And if not, I can always go to, complain to CMS, the Department of Health. There are many places that you can go complain. But you inform them first and foremost. Most of the time, if you tell them that it takes you way too long to get there, that it doesn't meet the 10-minute, 10-mile, they'll provide you somebody closer.
What about the question, like specifically orthopedics, that there's somebody who's close by, but the quality is inferior to someone who's a little further? So how does that work?
As long as they're contracted with that insurance company, that's an appropriate physician. They have to have certain standards to be contracted with each insurance company, and each insurance company can set that standard. But if you feel that you're going through AARP because you trust them, then you need to be able to trust that the physicians they're contracting with are going to meet the standards you're expecting.
Okay, so let's say we're working with your company, and there's somebody in Stony Brook that I want, and it takes me 2 hours to get there, but they contract with you, for that area. So then, can I go to that other doctor that's contracted with the agency but that's further away?
If you're going to a contracted physician, you can go to anybody that you want to. They'll send you a book of all the contracted physicians, and you can choose anybody in there.
Thank you. Thanks so much.
It's only
No
if
problem.
the doctor is on the panel,
Yes,
right?
yes.
You-
If you get that book of providers,
Answering
yeah,
your question,
yeah.
that, you don't have the flexibility to go to any doctor that you want because you have Medicare. choose Medicare C, you lose the flexibility to go any.
Right. This is a tight network. So you need, before you sign up with any managed care organization, that's first and foremost, you should be looking at their network to see if it works for you. No problem. There are strict guidelines that...
If you have C, then you don't use A or B.
Excuse me?
If you have C, then you don't use A or B.
C is the managed care part. You don't have to use C. You can go to straight Medicare, which is A, B, and D. So you can choose managed, which is all parts, A, B, and D, but it's in a managed care setting. Okay?
You wouldn't have A and C, then you're saying.
Yes, you would. Yes, you would. You're going to have A, B, and D regardless. C is strictly if you want it to be through a managed care organization, or if you don't, then you just get A, B, and D.
Do you pay extra for C?
You pay, I think it's about $7 and change straight out of your check. So you don't see it, and you sign up for it right away.
And this is the time now where they...
Yes, it's open enrollment right now. Yes.
So,
Yes.
So a person,
1 second. Oh.
a person in Brookline with A, B, C, and D.
Yes. Yes.
So the only advantage to C is that if you want to have managed, that some oversight by the managed care.
Exactly.
If you feel you can manage everything yourself, be happy with your existing doctors, you just have A, B, and D.
Absolutely. Absolutely.
So then, if you don't have C, then are you limited in your providers? Like how is that
No,
managed?
no, you're
You
not.
can go to anyone.
You can go to anyone.
Except Medicare.
Right, exactly. Yes.
But
But understand, having somebody there to help you through the health is a big advantage. It's not only a care manager that you get with managed Medicare. There are social workers that help get advanced directives done, healthcare proxies. They can help you with any of that. And we're going to get through it. They also offer disease management focused health care. They can help you focus on your disease, what issues that you may have, and help you manage your diabetes or your heart failure or your asthma or COPD. Different companies have different programs that can help their population. Just 1 second.
Are you going to address benefits and the disadvantages of supplemental?
The supplemental piece, that's not, but we can talk about it afterwards. We definitely can go there.
Is AARP this section C, or is it something else?
AARP offers 2 different programs. AARP offers C, and that's usually through a United or through Oxford, something like that. And then they offer a supplemental. So that's an extra out of your pocket that you're sending them, and they add on. Now, all these supplemental programs offer different things. Now, you're getting to a point that it's out of the CMS regulatory piece. So you have to be very careful on what they're offering. Does it meet your needs or not?
And those needs can change at any
At any point of time.
So there are hard things.
It's very hard. There are so many decisions that you have to constantly make with Medicare. You need to stay abreast of it.
Can you switch around?
Open enrollment period.
Okay, and after the open enrollment period, can you still get in?
You can, if you're just retiring and you're making that initial appointment, you can make that at any time. But once you've chosen for the year to go to an organization, you have to stay.
Question: if you signed up for C, could you still go to out of network and
No.
pay and
No.
take help you?
No. Once you sign up for a managed Medicare, you're in it.
So
You
if you go out of
do
network,
not
you
have.
to pay 100%?
You do not have out-of-network benefits. There is a chance
You can't use Part B?
you can't use it out of the network. You have to stay in their network. Now, there are times that there's a specific, very rare specialist that only deals with a specific disease process, that if you give the insurance company enough information to say you need that specific physician because you don't have anybody else that meets that need, then they can give you an approval for that. But that is very hard, very difficult. It's not an easy thing. And if there's somebody else in the network that can deal with your illness or your problems, they're going to direct you in network. That's the whole point of being in a managed care. They're going to direct you to their physicians.
So you lose Part B completely. When you sign up for Part C, you lose Part B.
You don't lose it because they still pay the benefits. It's that freedom to go to any other.
The network is the network Part C, not the Part B.
It's the network that the managed care organization is right.
So there's no advantage to having the managed care.
Well, there are different advantages. All right, so why don't we just keep going? For each person, again, I'm not advocating which one for you. Just make an educated decision of what you feel you need. I just want you to be aware of the options in managed network and not in managed network. And now you can go to a managed company that has 1,000 physicians and everybody is who's your physician already, and it may be perfect for you. So again, just be an educated consumer.
How about Part D? Part D is...
Part D can either be in managed care or not. So if you have a managed company, if you've signed up, your prescriptions have to go to the pharmacy that's in the network. So most of the big pharmacies are in the network, and most companies, you can probably go to a CVS, a Rite Aid, a Walgreens. If you want to use your corner drugstore, those are the ones that may not be in your program. Again, disease management is an option in managed care programs. Case managers will assist you, will arrange all your discharge planning. CMS gives you a right to appeal with managed care. You do, if you feel that you want to stay in managed care but you disagree, you are allowed to ask for an expedited appeal, which means in 24 hours that you've got to have somebody else look at your information. And then there are many steps to this, but you have a lot of rights with CMS. They do want all seniors to be aware that you're not locked in to a decision. If one medical director says it's not a service, but your physician hasn't given them all the information, they can give more information and keep appealing it. There are different levels to it.
How do you know which one to get? That's the thing. There are so many I get in the mail. How do you...
It's not easy.
Oh my God.
It's not easy. So that's why I'm trying to help you decipher this. Yes?
My union sent out a chart
Mm-hmm.
comparing in each category what the coverage is, so you could make that for yourself.
Yes.
The categories that are relevant for you.
Exactly. Okay, so with straight Medicare, there are no network limitations. There's also no monitoring to assure your physician meets the standards, the CMS standards, and there are no pharmacy restrictions. Okay? So you can go to any pharmacy that you want. There's no case management. There is no strict guidelines for getting services authorized. So if your physician says you need something and he writes a prescription, it happens. There are no hospital network limitations. There is no managed care network out there that is contracted with every hospital in New York City. Just understand that. You know, you may not have a need at Mount Sinai or Columbia or NYU right now. You're perfectly happy with whatever hospital you're in right now. But once you're in a managed care organization, they're going to, again, try to keep you to the hospitals they're specifically contracted to. Yeah.
So two things. One is, once you're in it, the next enrollment period, can you get out of managed care? Like, you opt out of it once you're, like, every year when you're in the renewal period, when
You
you're
can
managed,
opt.
and you can opt out if you decide to?
Yes.
Okay, and then secondly, do you find that, the number of the doctors you can go to,
Mhm.
and, if you're doing straight, you can go to anyone, but is there...
Anyone that takes Medicare.
That's what I'm asking. So how much better is it than being in a managed care? So are you really open to so many more doctors?
If you have the ability to advocate for yourself, if you have somebody that can advocate for you, it's probably fine to not be in a managed care program. But if you need to organize services in the home or through an illness, it really behooves you to go to a managed care organization because there is somebody constantly advocating for you. If you're not familiar with the medical authorization process, or how to get services, or when to get services, or how much services you need, it can get very confusing. Again, if your loved one, if you may need more home care services than 4 hours a day, 5 days a week, Medicare isn't going to give that to you. So even whether it's straight or managed, you're not getting more than that.
Doesn't the managed care company have an incentive to reduce services to the patient?
No. They have a goal to manage that member's health as best as possible. So what that means is that if the hospital wants to keep you in the hospital for 2 weeks, but you can get let's say you're on IV antibiotic therapy. You need 2 weeks of IV antibiotic therapy. Is the hospital the best place for you to get that services? I would say no, it isn't. There's a greater chance of getting hospital infections. You are limited to your little bed and your little area, so you're not walking around. The more you're not walking around, the worse it is for you. I can tell you that most people that go into the hospital, yes, I'm talking about seniors now. Yes, the issue that they go in for is handled, and it's handled well. But they tend to come out with other problems. Meaning, they may have some skin breakdown, some wounds because of it. They may not be able to walk as far as they did prior to the hospitalization. So there are a lot of issues that happen along the way, and the hospital is not necessarily the best place. So the managed care organization will say, okay, we know what's wrong with you, we know what issue you have, you seem to be responding to it, so instead of staying 2 weeks in the hospital, we're going to send you to a nursing home, a skilled nursing home, to finish getting that service. You're still going to have nursing service, but they're going to do some walking with you, they're going to do therapy with you, and make sure that you don't have that skin breakdown, that you don't develop a pneumonia, that you're not just staying in bed all day long. There's no rehab limitation, meaning that all the nursing homes you can go to. That doesn't mean you can have endless therapy. It just means the network is not limited. Everybody good?
How about foreign country?
What?
Foreign country.
If you're traveling,
Yeah.
there's always emergency services. always. All insurance companies offer coverage that for emergency issues, so it's not a problem.
Same as Medicare.
In fact, if you have a managed care company and you're any place out of the U.S. and you need further services, they will even arrange airplane transportation to bring you back. Yes. Yeah, I've seen it happen many, many times throughout my career. Worked very hard arranging, and we've had Hatzolah members flying people back and forth, going in through the flight with them. There's usually a doctor, a nurse, maybe even a paramedic through the flight for them, but they will arrange.
Medicare does not cover it?
Yes, but again, to arrange that outside of a managed care network is very difficult. Not impossible, but very difficult.
If a parent has United,
I'm sorry?
if a parent has United Healthcare, does that mean that they're part of the managed care? Or
Yep.
Yeah.
Yep. Yep. Yep.
In New York area, Metro, how many Medicare Advantage plans are there to choose from?
A lot.
Is that like hundreds?
Oh, yeah, there are a lot. There are about 50, 60 of them. There are a lot out there.
Are there any of them the same with just two names? Depending on the
No.
community?
No. But they, like I said, they all have to cover certain things, and then they offer some additions to it. So whatever you choose, just make an educated decision. If you're okay with advocating for your loved one or for your spouse or whoever it may be, then go for it. Stick with straight. But if you don't know how to manage through that network, it may behoove you to go through managed Medicare.
Are you going to have a list of different managed Medicares?
Oh, there are so many. You know, there are the Uniteds, the Emblems, the AARP. There are so many. There are hundreds of them.
How do you decide between?
Get the benefit package. Don't be pressured. You know the RVs parked all over the place? They all offer the managed Medicare. Don't sign anything because you're getting an over-the-counter card, an OTC card or anything like that. Understand the benefits that they offer. Get the pamphlets. You have 2 months' time, November, December, to make that decision. You can go on to the internet and just put managed Medicare and all the names will pop up for you. Call them up. Ask them to send what their benefit packet is. Read what it offers. See if their network meets your network. Now you can go online to even see their network. They can help you through their enrollment people decipher if your physicians are on their network or not. It's difficult. Yes.
Is managed Medicare synonymous with Medicare Advantage?
Yes. 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 It's one and the same. Yes.
I just want to clarify something that you said. If someone has Part D, obviously they're free to go to any doctor and go to Medicare. If they also have C, then they're restricted.
They're managed now, so they're in a network.
Right.
They're in the managed care network. So only their physicians that are participating in that managed care organization are the physicians you can go to.
Right.
So that's
Even though
what.
you get B, you can't use those.
Once you're in managed care, all three pieces go under it. So do your homework. Go online, see everybody's network, and understand. You're welcome. Look at their physicians, and it may be even more than your primary care physician. Look at the specialists. You may not have any heart issues, or your loved one may not have any, but that's an awful common need for seniors. So maybe look at it. Is their network accommodating who you may need?
So a person then could wind up, if they want to, with A, B, C, and D.
Yes.
And get a supplement.
Yes, absolutely. Absolutely.
And the supplement lets you do what? It adds on
It
documents?
adds another layer of coverage. So if you have, and I'm not saying this is because I don't have the benefit plan in front of me, but let's say the Medicare coverage gives you 20 hours of PCA, home health aid, a week if you have a skilled need. The supplement may offer another 10 hours. Or if you have 16 weeks of home physical therapy, a limitation with a managed Medicare company, the supplement may put it on for another 4 weeks. So there are different packages out there. You really should look. It may be an expansion of physicians also.
It might give you extra time.
Yeah.
Parents are Margateets, and the
Oh.
regular covered X number of days, and the supplemental covered 100 days.
Yes.
The husband had to leave before the wife.
Yeah.
And they were happy like that, but it made a big difference.
Yeah. It makes a big difference.
I went to a lecture given by someone who works for Medicare last week, and he said you absolutely see what you just said, you have to really look into it. But he said, I would have to say that most people go with ARP. So is that true?
It is.
Oh,
They're
it
the
is.
biggest.
Ah.
And AARP has about 3 or 4 companies that they refer to. They are not the managed care. They just recommend. These companies meet their standards. So I believe it's United, maybe Emblem. There were a few of them.
So they recommend these are the ones. Oh, but you don't take ARP?
No, it's United AARP. It's Oxford AARP. So it's through.
You don't have to be a member of ARP to get. You don't have to be an ARP member to get ARP coverage.
Oh,
you don't have to pay the annual fee to get your coverage through ARP.
Yeah.
Is the supplement only on C, or the supplement works for the regular, the straight Medicare?
The supplement sits on top of it. It gives you more than what you're getting.
And you have the supplement if you don't have C.
Oh, it's extra coverage, but when you don't have real limitations with straight Medicare, so it isn't something that you necessarily would need.
It gives you more time.
It gives you more time in a nursing home if you need that. It's not as much. You tend not to go there too often because when you have straight Medicare and your loved one needs to be in a nursing home, they actually can be there straight up to 120 days.
Is it medical necessity?
Yes, it's always medical necessity, but they always find something. I've worked with them with numerous nursing homes, so they end up finding something.
What percentage of what people go straight versus managed?
Most go for managed.
But it seems like it's hard to work the system.
It's very hard. It's very hard. It can be overwhelming if you don't have that experience.
Before about Part D, there's a supplemental, advantage.
You're welcome.
You don't like.
Yes, yeah. Well, you're going to get that anyway. There's only a limitation of how much prescription coverage you're going to have. When you have, the question was the donut hole. There are different, okay. For prescription coverage, if you have expensive medications, there's only a certain amount that Medicare will cover, and you're left in a hole until catastrophic expenses come out. So you can use Epic to help fill that hole. There are different supplementals that you can use. With the managed Medicare, what they also have to offer is a pharmacist that can get you coupons to help fill that donut hole. I know people who don't have the money. My pharmacist works with different pharmaceutical companies to get free medications so they can fill that donut hole. It's all, again, it's services. Can you get those those coupons straight from the pharmaceutical companies? You can, but you have to know what you're looking for. You have to know what to ask for. If you don't know what to ask, then you're not going to be able to access that service. Any other questions?
Thank you.
Thank you so much for coming.
Thank you.